name is Pharmacist Yinka Adekunle, and you're welcome to What Do TV. Today we'll be talking about a very important topic on health gist, and today's topic is cholera. I know cholera is not like malaria that people talk about all the time or typhoid, but today we're going to be diving into cholera in details. And with me, I have a very beautiful, wonderful guest with me, Pharmacist Debbie Austin. You're welcome.
Thank you.
Okay, we'll take a break now and we'll be right back. Please stay tuned. Okay, welcome back. Today we're going to be talking about cholera. Cholera is not an everyday topic like malaria and the rest of them. But I feel it is very important for us to enlighten ourselves about what cholera is and what it does. Okay, cholera is it's an infection part of places where there's poor sanitation and there's lack of proper sewage disposal, lack of good drinking water, and it can be found in areas like it's common in areas like Nigeria, Africa, Asia, Latin America. And in Nigeria, as of 2018, from January to October, there were over 40,000 suspected cases, and we had over 830 deaths as a result of cholera. So today we'll still dive into it. Pharmacist Debbie, you're welcome.
Thank you.
So what exactly is cholera?
Okay. So cholera is an acute diarrheal infection that is caused by the ingestion of food or water contaminated by the bacterium Vibrio cholerae.
That's true. And I think I can understand that it's transmitted via the fecal-oral route.
Yeah,
That
right.
means from contaminated from feces directly into maybe drinking water or food, and then someone ingests it and become infected. And it will shock you to know that cholera is actually a very asymptomatic disease condition. A lot of people walking on the road, on the streets, they are carriers of this Vibrio cholerae, but they are not showing any signs and symptoms of this condition. About 80% of people that are infected don't come down with any symptoms or even signs. So about 1 in 10 people actually show the signs and symptoms of cholera. And this Vibrio cholerae, the bacterium, it's not all the strains that actually bring out the disease conditions. Not all Vibrio cholerae cause cholera. About 2 strains cause cholera, and only one actively causes the cholera. So what are some of the causes of cholera, Pharmacist Debbie?
The main cause of cholera is ingestion of food or water that has been contaminated with that bacterium Vibrio cholerae. Now there are other causes like risk factors, things that makes people prone to getting infected with the disease cholera.
Okay.
And one of them is drinking dirty water, or maybe when a group of people that don't have access to good water.
Yeah.
Another thing is dirtiness, lack of proper hygiene. You know, when you don't wash your hand before eating, maybe you go to the market, you don't wash the food or the meat you buy from the markets, it could be contaminated with cholera. You wouldn't know.
Yeah.
And so the main thing is lack of proper hygiene.
Yes.
Lack of proper hygiene, nutrition, they are the main causes of cholera.
Even sometimes you probably got a good vegetable from the market, but the
Exactly.
water you used in washing the vegetable too can be contaminated, you know.
Right.
Yes. So what are some of the signs and symptoms of cholera?
The main sign and symptom of cholera is acute watery diarrhea. I say acute, it's just not like any diarrhea, but this has to be severe diarrhea, and then with dehydration. Those are the main symptoms of cholera.
Some other symptoms are low blood pressure, rapid heart rate, and the reduction in skin elasticity. I mean, when probably you pinch, the ability of your skin to return quickly back to normal, you is another sign that you get. And the dehydration, I think, is due to the diarrhea.
Yeah, due to the diarrhea.
Yes, and when we say acute diarrhea, we mean like within hours to days. Some people develop that symptom within few hours, while some people can last up to 5 days before they come down with those signs.
Yeah, that's
and
true. And
symptoms.
in severe infections with cholera,
Yes.
more than 1/4 of salt and water is lost within an hour,
Yes.
and that's what leads to like severe diarrhea.
Mhm.
And if this dehydration
continues,
continues, can lead to
shock and death.
Yes.
So you see, it's a serious condition that we need to dive into. So what are some of the treatments that we can,
Now you see,
take into consideration?
okay, so cholera is a very easy disease or infection to treat.
Curb, yes.
The main treatment is administration of oral rehydration solution.
Yes, for
Within
acute.
Yes, prompt administration,
Yes.
because it has to be treated immediately.
Yes, very quickly.
Prompt administration of oral rehydration solution, and then the World Health Organization oral rehydration solution, just a sachet, dissolve them 1 liter of water, should be administered to the patient that has cholera. And then for adults, you have to administer about 6 liters of oral rehydration on the first day.
That very first day.
On that very first day, to curb the dehydration especially.
Okay.
So the main treatment is administration with oral rehydration solution. And then for people that have severe cases of cholera, they have to be administered with intravenous solutions.
Yes.
Intravenous solutions.
Yes.
And then subsequently they'll be given antibiotics to curb the disease.
Interesting. So, what are some of the? I know diarrhea. It's a symptom of some other conditions that we are well aware of.
Yeah.
Like some people, they can have diarrhea when they have typhoid,
Okay.
when they have dysentery.
Yeah.
So how do you differentiate this diarrhea that is for cholera from the one of dysentery, and maybe for some people that have typhoid and they still have diarrhea?
Okay, now diarrhea is a frequent passing of watery stool.
Yes.
While dysentery, on the other hand, is an intestinal inflammation.
Mm-hmm.
It's an intestinal inflammation, especially in the colon, that can lead to one passing stool that has mucus or blood in it. Now with diarrhea, you don't have the mucus or the blood.
With dysentery or cholera.
With cholera, you don't have the blood or mucus
in it.
But then with dysentery, you have blood and mucus. That's like the main distinction.
Yes. And dysentery is also caused by entamoeba histolytica and Shigella species. So once they take this sample of your stool and they run it through the test, and they discover that you have Shigella in your stool or entamoeba histolytica, that means it's not cholera, because cholera is caused by Vibrio cholerae.
Yeah.
Thank you very much. So what are some of the preventive factors we can put into consideration that can help us as like a prophylactic measure?
The main prophylactic measure is actually providing access to good water. And then another thing that could help is public enlightenment on personal hygiene, especially in the rural areas. So many of them, especially in some northern states, so many of them rely on all these hand-dug wells. That's where their water comes from. And then most of these wells, they're left open. And then sometimes contamination from people with cholera can just go into the well, and these people drink that water. And so public enlightenment on personal hygiene, and then also provision of social amenities to these people, and then educating them on the need to maintain personal hygiene. I've said that like 2 times now, because it boils down to personal hygiene. Washing your hands before you eat, making sure the water you drink is clean, washing your food before you eat them, and then that's just it basically. Yeah.
So for areas that don't have those social amenities and they still have access to those hand-dug wells, they can boil their water.
Exactly,
boiling your water. Disinfect your water chemically. You you can add chemical disinfectants to your water, the ones that are safe for drinking.
That's true.
So these are some of the ways you can actually help. And for people that are in areas, maybe they like seafood, maybe you can probably reduce your intake of seafood because some of those things are gotten from seafood. People that consume a lot of seafood easily come down with cholera
That's right.
because some of those seafoods are already contaminated, maybe via the water. People should reduce the amount at which they probably defecate
Exactly.
into
In public places.
yes, water that probably people take for drinking or for cooking. You know, you need to reduce or completely stop defecating into those waters and look for an alternative.
That's right.
In the midst of everything going on in Nigeria, we actually can relate. I'm also a Nigerian and sometimes we can be tired. But in as much as we are tired, let's not give up on ourselves, on our health, most especially because we need to stay alive, we need to stay strong for the bright future ahead of us. We believe that this country will be great again.
Yes.
So we
Yes.
want us to please stay alive. Don't allow cholera to kill you before the bright future comes. Okay?
Exactly.
So we indulge us to please as an inculcate good personal hygiene, washing of our hands, taking clean waters to whether you want to wash your plates, please use clean water because once the water is infected, it's easily spreads, it's easily contaminates anything at all. So please let's try clean water for everything, for drinking, for cooking, for ice, for whatsoever it is you want to do. Please try and make sure you use clean water and stay alive. Thank you very much. Okay, we've come to the end of today's episode of Health Gist, and we want to appreciate Pharmacist Debbie for coming. I mean, for gracing us with her presence. It's been an awesome time talking to you on cholera today, and we appreciate our viewers for keeping still with us. I mean, you can follow us on all our social media platforms, What Do TV on Instagram and on YouTube. Please leave a comment and like and follow. And if you have any topic you want us to talk about, we are willing to take it. Please leave your comments in the comments box below. Thank you very much. Bye, everyone.